Dr. Bueller, great to see you.
Yeah, thanks for having me.
Well, we're talking about something interesting today in terms of how the virus is sort of in the air. And specifically, there was a modeling study that if someone is walking in front of you and you are walking behind them, that especially in a closed hallway, a narrow hallway, if the person in front of you is infected with the coronavirus, that can actually pass to the person behind you. What do you think about that?
Yeah, I mean, it's certainly possible. I mean, anything's possible with this virus. I do have a little bit of just issues in general with modeling studies looking at air physics. I think they're helpful as a way to generate hypotheses, but I really think that our main goal with describing risk with this infection should be based on epidemiologic studies. So are we seeing transmissions in people who have only been exposed to people passing down the hallway? And what I'll say is that by and large, what we're seeing are transmissions between people who are in close proximity, but spend prolonged periods of time together. And still the highest risk of you getting coronavirus is from someone in your household having coronavirus. So someone you're spending multiple hours with. So it seems to me rare that you could get COVID passing someone in the hallway or walking behind someone who has COVID in the hallway if it's for a brief period of time. Now, that said, it really depends on the local environment. For instance, if that's a very narrow hallway, you're spending a long time in it, and there's poor ventilation, that seems very conducive to spreading coronavirus. So much with this is just based on setting and exactly what the environment looks like, that you have to be protected at all times. And that's why we advocate for wearing masks whenever you're around other people.
Mm-hmm. And modeling studies can be a little bit tricky. They don't reflect what's going on in the real world. So tell us what an epidemiological study would look like, because there's so many variables that people are in different environments. A lot of things happen. So what would that look like? How would we be able to kind of hone in on this possibility?
Yeah, I would really want to see clear cases of transmission with the same virus, meaning that they're genotypically linked. They've got the same genes. In someone where their only exposure was being in line behind someone who was positive, or walking in the hallway behind someone who was positive. Like you mentioned, this is extremely challenging. But what we do see when we're looking at epidemiologic studies is exactly what I mentioned. A lot of the transmission is really related to cohabitation, living in the same place as someone, as opposed to these brief outside exposures. Not that it's impossible to get it this way. It's very, very possible to get it with brief exposures if the setting is just right. It's just the much more prevalent way of getting COVID is by these prolonged close contact interactions with people who are infected.
Mm-hmm. Okay. Well, while I have you with us, would you be able to talk a little bit about the COVID-19 variants, the variation of the
Yeah,
virus?
yeah, for sure. Yeah, happy to.
So we're seeing these. People are a little bit concerned that it might impact the vaccine. Um, I don't know. I'm not sure. Should this be something that we're concerned about first, specifically in terms of the vaccine?
I'm not sure I would worry about it in terms of the vaccine right now. A lot of the early reports that we have specifically from Pfizer seem to suggest that the vaccine would still cover this, but this is something that's it should be on our radar, and it's something that we need to watch very closely, because the target of the vaccine is actually the location of where the mutations are in these variants. So it's very possible that these variants might eventually be able to move around the vaccine, or with new mutations could move around the vaccine, something akin to what the influenza virus does on a seasonal basis. We just don't know yet. At this point, though, we have no data to suggest that the vaccine wouldn't work if you are infected with the COVID variant. What we do know with the variant, though, and the thing to be concerned about and something to keep in consideration, is that it does seem to spread more effectively. It does not seem to be more deadly at this point, or more morbid. Because of that, what we should probably start focusing on is more or better adherence to all of those procedures that we have already been recommending since the beginning of the pandemic. This isn't something where you would need new masks or new approaches to the infection prevention practices. From my perspective, really what we need to do is make sure that we shut down all potential mechanisms for this virus to spread. That means close contact exposures. This means congregant situations where people could potentially be interacting without appropriate protection. In those settings, if this virus is released, it seems to be able to spread like wildfire.
Mm-hmm. January and February could be our darkest months. What would you like to tell people of Indiana?
Yeah, I think that we still have at least a month with the surge, I would say, to start seeing decreases come down based on the projections that I've seen. And the best way to eliminate the high rates of cases that we're seeing right now is to, even if you don't think you're infected, try and reduce non-essential interactions with other people. And that's even with masks. Masks are not 100% protective. So continuing to make sure that you are staying at home when you don't need to go out, try and adapt structures such that you can get your groceries at home, or that you're able to take care of business from the home environment instead of exposing yourself to other people when possible, is still highly advisable. If you do have to go out, making sure that you're wearing a mask at all times, that even if you're wearing a mask, you're 6 feet between you and anyone else that you might be around, and that also that you're practicing appropriate hand hygiene anytime you're touching anything. Continues just to be the best advice that we have for reducing this type of infection, and is evidence-based in being able to curb the pandemic. So we have seen that adherence to these practices in other countries and even within the United States does decrease rates in the community. So we really need to just keep our eyes on the prize right now over the next few months until this vaccine can be more widely distributed, so that we can prevent deaths related to this infection.
Mm-hmm. Dr. Bueller, always great to see you. Thank you so much. We really appreciate your time.
Yeah, thanks for having me.